I'm here with Mary Butterworth from DDWA, and great to see you. And I would love to ask you some questions that we will then have on our advocacy training. I'm sure everyone wants to hear how your work has gone. So my first question is, who are you?
So Developmental Disability WA, we support people of all ages in Western Australia who were born with a disability. So that might be an intellectual disability, it might be autism or something else. And we support the person and their family to basically try and help make their life better.
So we've been working together for the last year or so. Tell me about that. What work have we been doing?
The Centre for Intellectual Disability Health asked us to do some systemic advocacy work in WA to try and improve the health outcomes for people with disability. So it was really helpful to get some feedback from the centre about what's some of the data about what is life actually like for people with intellectual disability. So the sorts of data we gathered were things like, people with intellectual disability die 27 years younger than their counterparts of the same age. They often spend way more time at emergency departments. And if they do go to an emergency department, they're more likely to come back within a month because whatever was the problem didn't really get sorted the first time. Their mental health is often, 2 to 3 times worse than other people of the same age. So as all this sort of data kind of information, like the facts and figures, have been really, really helpful for us to use in our systemic advocacy campaign.
So the centre and the driving change team, we worked with you, but you had a clear plan of, in the lead up to the election, how you wanted to, what you wanted to do. Do you want to tell us about that plan?
We were really concerned if we don't have a really clear message, we might be seen as a bit kind of mamby-pamby and really fluffy. So we actually listed, these are our top 5 things that we want the Western Australian government to do. And for example, one of those was to list people with intellectual disability as a priority cohort, because at the moment they weren't listed. There's a comment about people with disabilities are a priority cohort, but not people with intellectual disability. We also got videos of parents talking about their experience in the health service in terms of supporting their adult family members with intellectual disability. We also got interviews with adults with intellectual disability about their experiences, and that was really, really powerful. They were the scene setters. They were the things that actually captured people's eye and attention. And in particular, when we went to visit the Director General for Health in WA, we took along one of our experienced members. She's an older woman with intellectual disability, because even sometimes when the Director General asked a couple of questions, Georgie was able to say, "What do you mean? I don't understand what you're saying." And so it really brought home there's just all this assumed understanding about a whole lot of things, and it's not clear for people with intellectual disability. Things like they were talking about using a phone-based system where people could log in for their needs. And thankfully, Georgie said to her, "Well, I don't use my phone for anything else than making phone calls. I don't know how to log into anything, so that's not going to work for me." So it was that really practical kind of ideas and issues coming from the person themselves, which made all the difference.
Couldn't agree more. So tell me about, you did a lot of campaigning and advocating with the different representatives, and I know you met with ministers and shadow ministers in the lead up to the election and Deputy General, as you said. What have you found in the last year of doing this work, particularly in health?
I think that you can never start too soon. I think that when it gets close to an election, they get to the point where they're a month or two out. The political parties have already decided what their political platform is going to be. And so you need to get into them months and months earlier on about what are the issues you want to raise so that you get it into their platforms, particularly if they're opposition parliamentarians, so they've got something that they can stand up and say, the current party that's in power, they're not doing X, Y, and Z, but we're going to improve services for people with intellectual disability, for example. So if anything, they might even be fighting amongst each other in terms of getting the message out. It's almost the first parliamentarian or the first party that gets the message out has almost nailed it. They're the ones that can own it. So you might want to be strategic in which political parties you approach in which order. Because you want the ones that are the most outspoken to be the ones that take up the cause around people with intellectual disability. So, for example, the Greens were very quick to say, yeah, we approve, but they didn't actually do much action, versus when we contacted the National Party, they wanted to meet, they wanted to talk it through more, and they were actually more articulate about raising the issue and using it in a political way. Our message was targeted around people living in rural and remote areas versus some of the issues that might be metro based. So we had to kind of tweak the priorities according to which political party we were talking to. They're not going to bother if it's not something that they can really resonate with them and that they think they're going to get votes out of, because at the end of the day, that's what they're looking for, votes.
Yeah, exactly. So tell me, Mary, you also talked about Easy Read being like a Trojan horse. Is that something else that you found in this effort?
Absolutely. In many cases, and this is across all kinds of things, not just in health, sometimes different agencies, government departments, they don't really understand the needs of people with intellectual disability. They don't understand that often a lot of information is simply not readable because it's just too complex. And we found they found that writing Easy Read is something actually tangible they could do. They could do it within an existing budget. And by getting into a department and them working on even one document, it suddenly makes them start to ask the questions, well, actually, how do we deliver this service? How do we make it easy for people with disability to connect? And simple things like they would include a web address. And I said, well, you're assuming that people with intellectual disability are really competent using computers and can log into websites and find information, but maybe you need to have a phone number. So it really made them think twice. And then also they thought, here's an organisation that knows about intellectual disability. So maybe there's other things we can talk to them about. We're finding now that the health department contact us about a lot of things. And sometimes it's about Easy Read, or sometimes it might be about some kind of consultation or just our opinions on certain things. But certainly it's started to build a relationship which wasn't there before.
That's fantastic. And it is so much about like building those relationships that are collaborative, that is where you can kind of push at every opportunity, you know?
Yeah.
So where to next?
I think it's about keeping up those relationships and keeping the pressure on across a lot of places. So it's going back to different departments that express some interest in something and saying, how are you going with that? Now that I feel like we've got into the conversations with a lot of people, they're asking us about, research in relation to health. They're wanting to work with our advisory council about new projects or new ideas they're wanting to work on. So I think it's just about keeping up the relationships. You're coming into the go-to place that government agencies and others go to get reliable advice and information. And so similarly, I think that's what this project has helped us to do in the health arena, that we're now a place that they come to get specific advice around intellectual disability.
Just to close out, I wanted to hear if there's anything else you want to share about your work, or, how work at the centre, or, just...
I suppose I just want to show my appreciation and gratitude. I'm so pleased there is even a Centre for Intellectual Disability Health, because otherwise I would be absolutely floundering. And I think it's so useful to have a place to go to get really high quality information and advice that we can use. And I'm certainly now, as I get information coming through from the centre, I'm filtering it up to places within universities, within state health systems, and even in private health systems. So the more ways that we can channel the information out, the better. I think there's a real need to spend more time with universities. I think having people with intellectual disability go to universities and meet with medical students and co-deliver content is one of the biggest ways that we'll be able to actually change some of the attitudes of future medicos coming through the system.
Absolutely. Well, let's keep the partnership going and the collaboration. And it's been a great pleasure to work with you, Mary.
Thank you. Likewise. Appreciate it very much.